At the University Medical Center Radboud UMC in Nijmegen, the Netherlands, at the Expertise Center for Parkinson's and Movement Disorders, a team of care providers and patients are working to put the care for younger people with Parkinson's in the spotlight. How they are doing this? To be able to tell the story, let's rewind to 2011. We introduce Xander van Ruijsen. In 2011, he was diagnosed with Parkinson's disease at the age of 42. In the same year, he knocked on the door of Radboud UMC for a second opinion. Neurologist Bart Post then confirms that there is no way back. After living with Parkinson's for 3 years, Bart invites Xander to a bicycle ride called Boogie's Extreme. During this biking trip, care providers and patients raise money for Parkinson's research. The conversation that Bart then has with Xander changes his perspective on caring for younger people with Parkinson's forever. After the conversation, Xander and his wife Doreen draw a mind map that takes the shape of petals. Each petal or leaf contains an area of attention that Xander's Parkinson's has an influence on. Bart is surprised when he sees the drawing and realizes that the care he normally gives only covers one of the petals. The physical state, the motor symptoms in people with Parkinson's. Bart gets all fired up. He wants to improve the care for younger Parkinson's patients in the prime of their lives, applies for a subsidy, and hits the jackpot. The project which follows is called LEAVES, Life Phase Dependent Support. In several workshops, a group of caregivers and 15 patients prioritize a number of themes in Xander's petals that could be improved. The themes are then elaborated upon in separate groups. Ultimately, about 200 people work together, and only 2 years later, there are some very concrete results. For example, younger Parkinson's patients wanted a personal coach who would show them the way in healthcare. The Parkinson's nurse now fulfills this role at Radboud UMC. A second wish was an environment that promotes an equal relationship between patient and care provider. This wish is expressed in the living room-like environment created in the new clinic. They also wanted an environment for communication and the provision of information, tailored, validated by experts, a quick and reliable answer to a wide variety of questions. This resulted in the delivery of a so-called chest with drawers, a digital platform for the provision of information. An important ancillary yield, or perhaps the main catch of the entire project, was the formation of a community in which people with Parkinson's not only support each other in managing their symptoms, but can also reinforce one another by seeing and using each other's healthy sides and talents. The project ended in 2017. The recipe for co-creation has been patiently waiting to be shared again ever since. The team at Radboud UMC feels it is time to share the ingredients of success with others. Are you curious to the recipe for co-creation? Then go watch Parkinson's in Your Heyday Part 2.